Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And this is an interesting show. We had two areas of major interest that have come from you, the viewers. That's obviously cardiac disease is always one of the top three. It's always cancer, cardiac disease, and surgical techniques. And relative to surgical techniques, everybody wants to know about wound care, because we had a lot of folks that ask us questions about diabetic ulcers and non-healing wounds. So you got two experts that come from Broward Health North on Sample Road in US 95. And I figured, well, we won't do two shows, we'll do it all in one. So if you don't mind, we're going to do that. And if you do mind, it's too bad. I'm only kidding. Dr. Danish Sheikh.
Yeah.
Okay. And you are a doctor, you're a board-certified cardiologist. I know that you did your fellowship right here in Florida.
That's right. That's right.
Up in Largo. Mm-hmm. Actually, it's one of our programs from Nova Southeastern University.
Yeah, I did my internal medicine residency at Largo, and then I did my cardiology fellowship at Broward General.
Oh, at Broward General?
Yes. Uh-huh.
Oh, so you worked with Dr.
Chisner and
That's
Dr.
right.
Yes,
See, I'm
that's
going
right.
to let you say it, all right? Because he's my cardiologist, so I can't say it.
Oh, okay.
But anyway, I'm glad that you're there. In fact, I remember seeing you one time.
Yes.
At the front desk, I was checking out. So we have Dr. Sheikh, who's a cardiologist, and then we have Jacqueline Cameron, who is a wound care center nurse professional at Broward Health North. Welcome.
Thank you very much.
Good to have you here.
Thank you.
And you received your education at FAU?
Yes.
Correct?
That's correct. Christian College of Nursing.
Right. So let's, if you don't mind, let's start with the wound care issue first, because there's been a lot of folks that have been talking to us about these terrible oozing wounds that are on their legs, sometimes on their arms, but usually on their lower extremities. And they just don't know what to do, you know? They go to a pharmacy, they go to a supermarket, the medical pharmacy section, and they buy a lot of things off the shelf, and no matter what they put on, they can't heal. Mm-hmm. And they often are not referred to a wound care center. And you all have one of the finest wound care centers in all of Florida. So let's talk about it.
Yes, I work at Broward Health North Wound and Hyperbaric Center, where we offer treatment for many different types of wounds, including venous ulcers, neuropathic or diabetic wounds of the lower extremities. Usually they are on the feet. In addition to atypical wounds, pressure ulcers, all different types of wounds there. So we work closely with podiatrists, plastic surgeons, trauma surgeons, vascular surgeons, and we also have the hyperbaric and oxygen treatments there that can help in healing and promoting healing for different types of wounds and ulcers.
As I understand, a very, very efficient and helpful opportunity for some of these very difficult wounds to be healed. Is that correct?
Yes, that is correct. Actually, at Broward Health North, we have two of the largest and most advanced hyperbaric oxygen chambers created by Seacrest, and patients who qualify can receive hyperbaric oxygen treatment, and it really helps in promoting the flow of oxygen to compromised tissues, renewing vessels, and also it helps with infected wounds because it helps the white blood cells to activate. So it's really a very helpful therapy. It's usually a 5-day-a-week therapy, Monday through Friday. But it's not only the hyperbaric oxygen that is helpful. At Broward Health North, we really work as a team, and we consult other entities to help. Like podiatrists will help with offloading. Maybe they need to revisit their endocrinologist. So we look at the patient as a whole to really see what is the issue. Why isn't this ulcer closing? We can't just put a magical dressing on and expect it to close. We have to work with the patient as a whole person and see, what is the cause of this? Is this a vascular issue? Is this a neuropathic issue? Is this an issue because of an atypical disease? So we really try to investigate further.
Really, the wound care issue, and that's why we get so many comments from our viewers. And it's not only senior folks, it's a lot of folks that get into, you know, unusual, shall we say, trauma cuts,
Right.
and infectious things. They go. We had a message here from someone who did a trail hike and got this cut on some rock or something, and it didn't heal. It went on and on. Where can I get help? And that's why I wanted to do something on wound care. The hyperbaric chambers, by the way, and there's been a big change in hyperbaric chambers. I don't really know whether your chambers go up to 100% oxygen. I have no idea. But I do know that there's been discussions and reports relative to the percentage of oxygen which is used, and again, you have to tell me, what percentage of oxygen?
Yes, ours is 100% oxygen, and they're treated at a higher level of atmospheric pressure than normal, usually about 2 to 2.5 times higher.
So that acts as a concomitant value added situation. In other words, it makes the oxygen be the prevalent healing source rather than it's just
used
helping.
as a medication. It's like a medicine, a procedure.
Right.
Like you take a pill by mouth, and oxygen is a therapy of medicine that can be used in treating these difficult wounds. Like you were saying, different wounds like crush injuries, that can be treated with hyperbaric oxygen medicine, compartment syndrome. Other acute traumatic ischemias that result can be treated with hyperbaric oxygen medicine.
Now let me talk to our cardiologist, who was trained by someone that I know very well. Give me some insight into, firstly, where are you practicing at that Broward Health? Or
I'm practicing at North Broward Hospital. It's right attached to the hospital itself.
Right attached to the hospital, right. So it's a medical office building?
Yes, medical office, physician office building.
Right. And I would assume you have the privilege because of I guess, I don't want to say that you're younger, but because of age, that you had the opportunity to see some of the incredible changes in cardiac care.
Yeah.
So let's talk to the people because they're interested in everything, especially I can't tell you how many times people talk to us about stents and minimally invasive procedures. So let's get into that.
Yeah, you know, you raise up a really good point. There is a lot of research and a lot of money that goes into the research for cardiac disease and preventative medicine, as well as, well, what can we do with the current conditions and how can we reverse these things? Cardiac disease or coronary artery disease or even just heart attacks is just a portion of cardiac diseases that we're taking care of. You know, you got hypertension, high cholesterol, diabetes is even involved. You have, you know, heart failure is a big portion of it. A lot of new medications have been coming out treating these diseases, making life expectancy, mortality much better than it has been just even 5 years ago. So a lot of innovative things are happening in the field of cardiology for sure.
Well, there's no question because, you know, and again, I'll let you comment on it, but there's been so much over the years, and I'm sure as a nurse professional you've heard it as well, about, you know, diets, fats, saturated fats, cholesterol, et cetera, et cetera.
Yeah, absolutely. And again, you're right about how quickly and how much it changed over just the past few years. Talking about diet, the American Heart Association, American College of Cardiology, current recommendation is what they call a Mediterranean diet. That's what they mean by a heart-healthy diet. So that's going to be your veggies, your fish, your nuts, kind of like that Mediterranean diet that you would expect. Staying away from fried foods, things like that. So that's kind of the diet that they talk about. As far as exercise, which is another big part of cardiology, the same organizations, American Heart Association, American College of Cardiology, they also recommend at least 3 to 4 times a week of exercise, and this is going to be about 30 minutes to 40 minutes of high intensity, meaning high heart rate exercises, something that's going to make you sweat for about 30 minutes, 3 to 4 times a day. Now, finding the time to do those things, I find a lot of patients have a lot of difficulty finding that time. And if you want to stay out of the hospital, if you want to decrease your medications and improve your heart health, amongst other things, which diet and exercise have been shown to improve, it's probably one of the best things for you that you can do.
Well, thinking back to a show where your leader and mentor, Dr. Chisner, was sitting right there, he spoke about the same issue, but he added another factor, hydration.
Oh, yeah.
He was very big on hydration. He said that one of the biggest problems that he faces with people who finally get to him for care, and it isn't because of a tragedy, it's just, something's gotten to them, and they get to the office, and he really lets them know about hydration. You want to talk a bit about it?
Absolutely, yes. One of the big things that we've seen, especially down here in South Florida, where the weather is very hot and there's a lot of people who work outside under the hot sun, not staying hydrated can cause a lot of neurological or even cardiac issues, mainly fainting, passing out, palpitations, in relatively normal, young, healthy people, or it can happen to the elderly too. Something called neurocardiogenic syncope, which is something that Dr. Chisner is quite an expert about. And in his office, we do see a lot of patients who suffer from that. And hydration is going to be a big part of that. Blood pressure control, making sure that blood pressure doesn't drop too much, because if one's dehydrated, can cause the blood pressure to drop, cause orthostasis, orthostatic blood pressures, and things like that. So yes, absolutely, especially down here in South Florida, being hydrated is very important.
Well, I'm going to get back to you now, Jacqueline, if you don't mind.
Sure.
Let's talk about who refers, or is it just hospital patients that end up in your care, or there are referrals into your system?
We have referrals from different places, not only the hospital, but sometimes primary care physicians will refer the patients to us. Sometimes patients they actually investigate on their own to see, where can I go? They say, oh, we hear Woundcare Center, hyperbaric. So they call our center. We also have some home health companies where there's nurses who are saying, we have our patients and they're not closing, their wounds are not closing, so can we refer them to you? And they come. So we have referrals from all over. Some oncologists, sometimes there's a delayed injury due to radiation treatment, osteoradionecrosis, soft tissue necrosis, and they will call our center and see, because that is one of the indications for hyperbaric oxygen treatment. So yes, and nutrition is also very important for wounds as well, to promote healing, because if a patient's not controlling their blood sugar levels and they're diabetic and their hemoglobin A1C is too high, then it's going to have a bad effect on healing. If they are not taking in enough protein, if they're malnourished, all of those things play a role in wound care.
Is there and I really don't know, so that's why I'm asking you, in the Woundcare Center, which is a specific entity at North Broward, is there communication with the registered dietitians or nutritionists that are...
We can consult the nutritionists, but we also have information, patient education, where we can ask them, do you need a nutritionist? Normally they have home health care, and home health care can also refer, but yes, we do work with them regarding their diet. We work closely with their doctors, with other nutritionists. Yes, we do. The Wound Care Center is, every day there's a different physician. So it's a 6-room. It can hold up to 6 patients at one time. Right. And it's kind of like you going to a doctor's office. The patient comes in, they have a seat, we do their intake, the nurses measure, assess the wounds, we present the information to the doctor, then the doctor comes in, and we work together as a team, and we discuss what's the best idea for this patient, depending on what type of ulcer. So if the doctor says this person's hemoglobin A1C is 10, this is not going to close with that level. So we might need to refer them to a nutritionist or an endocrinologist, or tell them, you have to exercise, you have to move, you need an offloading device. So yes.
Well, it's interesting, but the reason I brought it up is because in listening to Dr. Sheikh, it's interesting how the body, which is an amazing mechanism, recognizes the need for hydration,
Yes.
proper nutrition, exercise, which in one case you'll be talking to a cardiologist, in this case I'm talking to a wound care specialist, and yet it's the same issues.
Right, and I think one of the main issues is patients' limited knowledge about the issue. Patients come in, they have no idea what to do. They're diabetic, they have no sensation in their feet, and they're walking on this ulcer all the time with pressure and pressure and pressure. They have no idea. They can't feel it. There's no pain. There's no sensation. So they continue to do things, and they don't know. They need to be educated. The idea is once they have this ulcer, the idea is prevention, but once after they're closed, prevention, but while they're there, a lot of patient education, because they can't do what they don't know. And when they come, they say, how come no one ever told me this? Why didn't someone tell me this? I said, I don't know. I'm not sure why they didn't tell you this. But from now on, this is what we need to do. This is our plan of care for you. And that is number one, because we can do whatever we want to help the patient. But if the patient's not complying, then some of these things are not going to help.
Now things are changing. And now's the time for the folks out there to take advantage of them. With that, Danish, it's always amazing to me how people end up seeing a cardiologist. It's usually after something, I don't feel well.
Right.
Or I had this pain, or I couldn't breathe. But the reality is, as you would know, and I'm sure that your mentors would tell you, that everybody needs baseline information, and particularly in cardiology. After all, it's the motor that keeps us running. It's the brain and the heart.
Yeah.
So let's talk a bit about people when do they need to see a cardiologist?
So you bring up some great points. Well, first thing about your preventative care, that I think is the main treatment plans for a lot of patients. What can we do to stay out of the hospital? That's going to be the most important thing. So diet, like we talked about, exercise, like we talked about, making sure that you follow up with your doctors, making sure that everything looks okay. Hypertension, high cholesterol, they're called silent killers because they attack without you really having any symptoms of something going wrong until it's too late. By going to your doctors to make sure everything's okay, it's like going to a mechanic to make sure your car is working fine. You don't want to find out when you're on 95 stuck in traffic that your car's not working anymore. Just like you want to make sure that your body's working and functioning fine. So making sure that you preventative care and making sure that you're taking your meds and doing the exercise and all that, that's going to be very important and a cornerstone of your daily care. As far as at what point you should see a cardiologist, usually if there's something wrong, if something feels abnormal, you go to your primary care. The primary care is going to be telling you, hey, listen, let's do these studies, or you know what, you might need to see a cardiologist because based off of the physical exam and the story that you're telling me, things don't look right. That's when they would come in and see the cardiologist. Cardiologist would then come in and say, hey, listen, we've done these tests, your story, and you have certain risk factors. We might need to do further cardiac workup. And that's where we would kind of becoming more aggressive into this imaging studies such as echocardiogram, stress tests, Holter monitors to take a look at arrhythmias, to figure out what could be causing these issues that are bringing you discomfort, things that are out of normal. Everyone is understanding of what their normal is. When something abnormal happens, that's what causes them to come, or should cause them to come and take a look and, hey, maybe something needs to be checked out.
Well, again, I always said people want to know, we're going into our almost 18th year of having this show and having wonderful people like Rita Silverman be my executive director. But they want to know, why do you keep on going? I hope that people get information, which is important, whether it be for wound care or whether it be for cardiac problems. So just one more quick thing. Sure. I know that often people, because we have so many people that are in our community that are mature, elderly. My mother wouldn't like me to use the word elderly, but it's okay, mature. So we have the highest percentage of people over the age of 70 in the United States. We have the highest number of people over the age of 80 that live in the state of Florida. And these are survivors, they're physical survivors. However, they still want to go on. And there's a very distinct need for example, the person who's walking around with an ulcer on their they can't feel it because of their diabetes, or the person who puts off heartburn, or it was just an immediate, it didn't mean very much, it went away. How do you overcome that as a physician? I mean, it must be really exciting when you are able to help someone live out a respectable, desirable life.
Absolutely. I mean, it really is. I don't think there's anything, I mean, obviously I'm a little biased, but I don't think there's anything in this world that's much more rewarding than helping patients out and able to continue that life that they're trying to lead. As far as the pains and things that, what you were talking about in your story about heart attacks, the classic textbook symptoms that one might be looking for in these patients would be chest pain, chest tightness, pain radiating down the arm or neck or to the back, shortness of breath, palpitations, dizziness. It's an array of different symptoms. Not always is it associated with the heart, but then you have to look at your risk factors. If you have a history of high blood pressure, family history of heart disease at a young age, history of high cholesterol, if you've had a heart attack in the past, or if you've been told that you might have some blockages from previous cardiac caths or stress tests, these kind of add your higher risk of developing heart attack-like symptoms or ischemia. My job, my goal is to make sure not only does the patient get treated, but also that they live in the way that they want to live. Not all patients are going to want to take all these medications, or not all these patients are going to be able to take all these medications. So we have to find a fine balance between how can we help the patients live the life that they want to live, but also treat their symptoms. So there is a balance to that, which again is going to be really important, why they need to follow up with their doctors and their cardiologists once, if they're treating a chronic issue, to make sure that we're on top of it, that we're not losing or missing anything under a rock or anything like that.
Jacqueline Cameron, we're down to the last 2 minutes of the show, but I really I know the magic of a wound care center. I mean, God bless my mom, who's no longer with us, had the care of a wound care center, not your hospital, but a hospital in the south end of the county. But it's amazing the amount of relief that she got, both physically but equally psychologically. That's correct. A lot of patients who come to Broward Health North Woundcare Center, Wound and Hyperbaric Center, they come in and they're so ashamed. I've had patients who come in ashamed and they say, I've had this wound, I try to take care of it myself, it's disgusting, I feel horrible. And I try to tell them, venous ulcers, venous insufficiency, ulcers caused by venous insufficiency are the #1 ulcers seen in an outpatient wound care clinic. And I tell them this is a very common thing. Don't be upset, this is something that is treatable, and we treat with compression, and it's going to be a lifelong issue that you'll deal with, but we'll help you. You'll have your compression, you'll follow up with your vascular physician, you'll follow up with your internal medicine physician, and it's just a lifelong, and it is mentally difficult on a lot of people.
And I tell them, you have to try to be strong, because being depressed, it's not good for your immune system. It brings your immune system down, and we're gonna get through it. Just be compliant, and we try to work as best as we can with them.
Well, I always say in medicine, advocacy is a major tool, and
Yes.
you being an advocate and putting a smile on your face when you're talking,
Yeah.
I think is very important, because a patient relates directly to what you say.
Yes.
I can tell you that in cardiology, and I know your mentor, by just putting their hand on you, does an awful lot to mitigate some of the anxiety that's related to their problem. I want to thank both of you for being here. Jacqueline Cameron, your Woundcare Center of Broward Health North. Thank you for your professionalism, but more importantly, thank you for your advocacy on behalf of your patients.
Thank
I appreciate it. And Danish Sheikh, you're one of mine, in a sense. We're very pleased and very proud of the fact that you got some of your knowledge associated with Nova Southeastern University. Thank you for your service in the community.
Thank you so much, and thank you for having me.
Well, we're welcome. Folks, I hope we answered some of your questions. I know there were a lot of wound care questions, but I wanted to, it just turned out that we did this show as a sort of a split show, because it's the way the scheduling worked out. But the most important thing that I got to tell you is, I always say to you, take good care of yourself. That means don't put aside the fact that something is not healing. Get to a wound care center. Don't put aside the fact that, I walked up the steps and all of a sudden I'm not breathing correctly. It was too much for me. I shouldn't be walking steps. I had this little pain. Don't put it aside. See your primary care physician. Get your referral to the cardiologist. Take good care of yourself. You are the mentor of your own health care. You got to take good care of yourself. Again, if you have any questions, you want some answers, there's an email address and telephone number right here. And remember, as I always tell you, this is your show. The show is called Dateline Health. Comes to you from Nova Southeastern University. My name is Fred Lipman. Until next time, see you.